Good morning, everybody. Welcome to another edition of North Shore Eye Health and Wellness monthly video blog, Eye Openers. We're doing part 3 in our series today about corneal refractive therapy. The last few months we have introduced this topic as a means of controlling myopia progression, or what's called nearsightedness. Lots of us are familiar with nearsightedness. The typical adolescent development of nearsightedness happens between 12 and 22 years of age. But recently, in the last 5 to 10 years, we've started to see myopia development happen much sooner, and that's causing progression and elongation of the eye, which can result in greater risk for retinal detachments, glaucoma, and cataract development. So a big focus in eye care and eye health has been, how can we help these children? How can we slow down the progression of nearsightedness and keep their eye at less risk for potentially blinding diseases? The topic we've been introducing, corneal refractive therapy, has really revolutionized how we are treating these patients. In the past, myself included, I would go to an eye doctor, I would get a prescription, a new prescription every year, and it would keep increasing year after year after year. We talked a little bit about the encouragement of outside play. Exposure to natural light helps prevent the stretching of the eye. So certainly behavioral aspects play a role. However, if we physically manipulate the eye with things such as the corneal refractive therapy molds, we can make a physical environment which is not as prone to stretching. And corneal refractive therapy has certainly shown that if we continue to wear these lenses, our progression of nearsightedness is cut in half, essentially. Myself, I'm a minus 650 or so as far as a prescription is concerned. Had I worn these lenses, I had a really good chance of a prescription being around a minus 3.25. So much smaller in terms of prescription. If we can keep a prescription under minus 4, our risk for those complications is much less. So who's the ideal candidate? When I have someone sitting in my chair, who do I recommend these lenses to? Well, really anybody who has nearsightedness. Now there is a limit. The earlier we catch the nearsightedness, the more effective the corneal refractive therapy will be. It was originally designed for adults as an alternative to LASIK, so there really is no age limit. It's a very safe and effective way of correcting nearsightedness. However, just like LASIK, we have limitations. The prescription cannot be very high, otherwise we won't make an impact. Ideally, we catch kids when they're first starting to develop nearsightedness, when their powers are small, less than a minus 2. If I can get a lens on the eye at that point in time, the mold will be more successful, number one. And then number two, our chance of keeping the prescription under a minus 4 or a minus 5 as we progress is much better. So typically, we're fitting these molds on 6-year-olds to 12-year-olds. That's a pretty good range. However, we'll fit them on any age as the child continues to grow and help and hope to slow down that nearsightedness. Ideally, we want to also have a smaller amount of corneal astigmatism to start out. These molds are getting better and better, and when we have astigmatism, the cornea is not perfectly round. It has more of an oval or football type shape to it. This creates a little bit of a challenge when we're creating the mold to fit on the eye. However, we've gotten much better and the lens technologies have improved. Nevertheless, we want to keep the corneal astigmatism to a smaller amount. So there is an upper limit on that as well, which we take into consideration. But all of the things I think that are positive about these molds, they really don't impact the ocular surface. If we have chronic dry eye or allergies, these molds are perfectly safe. The other thing is it's perfectly reversible. Once we start this process, it takes about 2 to 3 weeks for the molds to really take their full effect and for the cornea to learn that new shape. As long as we're wearing the lens every night, we are very successful. When we want to stop, same thing, the cornea can go back to normal. However, it takes about 2 to 4 weeks for that shape process to demold. It's very smooth and very easy, and we'll be here with you as you're going through that process. So ideally, we want to catch someone very young with their nearsightedness. We want to fit the molds early, and then that will allow us to be more successful over the life of adolescent nearsightedness. If you're interested in pursuing corneal refractive therapy or curious if you're a good candidate, simply give us a call. We have lots of good information on the website, northshore-i.com, under myopia control for kids. Of course, at any point in time, give us a ring, stop by the clinic, feel free to chat with me, and we can give you much more information. So hopefully these last 3 segments have been very informative to you. We look forward to hearing from you and working with you in this revolutionary new technology. Thanks, and hope you have a great month.